Thank you so very much, Sister Arlene. And once again, Sister Arlene can be found every Thursday at 7:15. Y'all make sure y'all check her out and Feeling Nourished with Dr. Bell now. She just got a clinical nutrition degree, y'all, so she's Dr. Bell, okay? Every Thursday, so check it out. All right? Now, please, keep yourself on mute. Grown Folks Talking, Express Yourself Progressive Podcast Network. I am your host, Brother Forrest Nance. I had to repeat that a second time because now I'm being recorded. All right? My special guest, all right, on this day, all right, is Sister Dear Harper, Charlene Harper. You call her Charlene. Don't call her Harper unless you put sister in front of it, either name. All right? So without further delay, I'm going to have Sister Harper come on and give you a brief bio of herself and what she'd like to discuss with my audience. I'll start the interview. And as you know, family, we do Q&A at the appropriate time. So, Sister Harper, I'm passing the mic along to you. Once again, thank you for coming on the Grown Folks Talking Network, Sister. And the floor is yours.
Yay! Hi, everybody. It is such a true pleasure to be here. Thank you so much for having me. My name is Charlene Harper, and I am tapping in from Boston today. And so it is such a wonderful privilege, truly, to be here with so many fantastic, like-minded individuals because we all care about our health. So I'll give you a little bit of an introduction about myself. I am a Christian and a director of medical coordination to a Neuro-Recovery company. I'm a Neuro-Recovery strategist. I've been doing this for 35 years. My wheelhouse is traumatic brain injury, spinal cord injury, and post-concussive syndrome. So basically, all head injuries. I lead a faith-based practice focused on guiding car accident survivors through neuro-recovery and life support retraining. I was formerly an athletics instructor at MIT, and I combine science, faith, and compassion to advance neuro-recovery and restore independence. At the end of the day, my ultimate goal is recovery. So thank you so much for having me. I can talk about anything medical. I love what I do. I wouldn't want to do anything else. And so I'm just blessed to be here. Thank you so very, very much to you, dear sir, for having me. And to you, Arlene, you have been a true, true support. And so I just wanted to say kudos and thank you so much for having me here.
Well, no problem. Thank you, sister. Sound like you remember Arlene's name. You forgot mine. Just remember the forest and the trees.
You know what? You're listed here as CEO.
Oh, okay. Well, you know what? I have to step to the side, get out the car, the driver's side, and open up the passenger door for the queen or the goddesses out here. So, Sister Arlene, I'm going to let you start off since you co-host with me up here and you're my tech person. Is there anything that you would like to ask Sister Harper before I intervene with my interview?
Sure, but Sister Harper, I think, has a slide prepared, correct?
I do. So if you could walk me through how to do that, because I don't believe I'm a host or a co-host.
Oh, so I would have to make you a host. Oh, no. Hold on one second. Let me see how I can do that. So you don't see at the bottom of the screen where you can share?
No, ma'am. I do not have the option.
Well, she came in as a participant, Sister Arlene.
Okay, so hold on. Let me find that right quick. Well,
okay.
While Sister Harper continued to give us information, and let me look that up for you, okay?
Okay. Because on your end, you can't do that on the board. Thank you, Sister Arlene. Appreciate that. So, in the meantime, Sister,
yes,
trauma. Okay, since we have our participants that are listening in the audience, could you please define trauma, and if there are many other different divisions or tiers to trauma?
Absolutely. So basically, we are here to talk about head trauma. And if you could ask me, if there was one organ in the body that you would have, that you would really want to remain intact, it would truly be the brain. And the reason it would be the brain is because what the brain does is it is the coordinator. It is the main processor that tells every cell and every nerve in your entire body what to do and where to go and how to get assistance. And it manages the ebbs and flows of recovery, of everything that has to do with the human body 100%. So when it comes to trauma, we have a number of different ranges, but for the most part, the ultimate goal is what happens when you hit your head, right? And so I'm not specifically speaking about emotional trauma today, although there is some emotional trauma with loss of function, right? I just want to really try to hone in on, and why is this conversation important? So I'm going to back up by one progression, sir, and answer the question, why is this question relevant? Why am I here? What does head trauma have to really do with anything? So the reason that I'm here is to basically give some information, some education, and answer some questions about what happens when you hit your head. And if you're a senior or if you know anybody who's a senior, what, the general information that they receive is don't hit your head. And the reason is because depending on how the impact happens or where the impact happens, you can, your entire life can be changed forever, okay? So when it comes to head impact or head trauma, now here's the ironic thing. Head injury is a tricky phenomenon. It could be something as simple as you're reaching down to put some things into the dishwasher and your partner opens up the cabinet and you come up and bam, you hit your head, right? It could be something simple like that. It could be you've been in boxing for 50 years and you've had a number of different concussions, and, it could be something simple like that. The explanations can always be simple. One of the more challenging explanations for head trauma, like how did we get here, is often when you're in a car accident and you don't hit your head. And so when it comes to trauma, you don't always have to hit your head in order to have an impact injury. You don't always have to hit your head. And I am a concussion survivor. I had 8 concussions in my lifetime. All of them were car accidents, except for one. But the last car accident, I never hit my head. I was hit from behind. All of my car accidents, I was hit from behind. But because I didn't hit my head, I didn't, and I'm in this industry, right? Because I didn't actually literally hit my head, what ended up happening, oh, thank you. What ended up happening, I appreciate you so much. Here we go.
You got it.
Thank you.
Okay.
Here we are. So because I didn't hit my head, I didn't go to the ER right away. So here's my little presentation. I want to talk super fast about Can everybody see? Can anybody see? I just want to make sure. You can?
I can.
Well, some people will stay on audio and some will do the visual. I know Arlene has. So for those of you who have access to the camera, you can see Sister Harper if you turn on your camera.
Okay.
Most of us will use the audio, though, Sister Harper.
All right, no worries. I will be.
Don't worry, I'm recording it, so I will send it to everyone as well.
I appreciate you for that.
You got it.
Okay, so I'll be mindful to make my descriptors specific so that if you only have audio, it's not going to be a problem, okay? So I wanted to describe super fast the architecture of the brain. And basically, I split the brain up into three major parts: the cerebellum, the cerebrum, and the brainstem. And the reason that it's important is because the brain only weighs about 3 pounds. That's the adult brain, weighs about 3 pounds. And, you know, it is the governor. It governs every thought, every movement, every emotion, every body function that you have. It processes everything, so it's not just that it sends the commands to do it. The brain is the only thing that understands what is happening, okay? So when it comes to the cerebrum, it's comprised roughly of about 85% of your total brain mass, and it's divided into two hemispheres. And those two hemispheres are called the right brain and the left brain. We've heard about those. It is connected with the corpus callosum, and that's important because that's the bridge that transmits information between the right side and the left side. And each hemisphere of the right and the left side brains, right, they have four lobes. So we've got the frontal, we've got the parietal, which is on both sides. We have the temporal, which is up front near your temporal lobes, and the occipital, which is in the back, okay? So essentially what they control, your frontal lobe manages your executive function. So your executive function is your ability to make lists and to parse information and then to get the jobs done, right? So that's a major piece because the frontal lobe is often the part of the brain that gets injured the most. And then when you get injured, you can make the lists, but you often have a tough time getting things done, right? It also is involved with decision-making, personality, voluntary movement, speech production. The parietal lobe, which is on both sides, is your sensory integration, your spatial awareness, touch, pain, temperature, your body orientation. Your temporal lobe is your hearing, language comprehension, memory consolidation, emotional regulation. And the last one is your occipital lobe, which is at the back of your head, which is your visual processing, color, depth, motion detection, and object recognition. Now, the reason I wanted to talk super fast about your brain and what it actually literally controls is because when you get injured or when you hit your head, and even if you don't hit your head yourself, when you are in a space where there is an impact, what ends up happening is your brain will become reactive. So I often tell people your brain is like a little peanut in the can. So depending on how the can is hit, it will depend on what actually literally happens to the brain. Okay? So I wanted to talk super fast about the cerebellum and the brainstem, and these two pieces are the life support duo. So your cerebellum is located at the posterior base of your skull, at the very back and the bottom, and that contains over 50% of all the neurons in your brain. It is the size of a small rock. I have an example of what what the rock looks like, but for the most part, this is actually critical because in a cerebellar injury, it produces ataxia and uncoordinated lurching movements and is commonly seen in blast and rotational injuries. So the long and short of it is where you get hit, and you don't even have to get hit in the back of the head. If you get hit in the front of the head, the reverb, or, again, if you think of that little teeny peanut in the can, ends up shaking the brain. And so you can have an impact injury, or you can have the actual injury to a specific portion of the brain itself. If you can think of that little peanut being sitting in fluid that's kind of like a gel, that will give you an idea of what your cerebral, your CSF, your cerebral spinal fluid, and how it sits in there. Your brain stem is kind of sort of the electrical part of your body, right? It controls your midbrain. It controls your breathing, your heart rate, your blood pressure, your consciousness, and it also controls arousal. But it contains your reticular activating system, and that is the seat of your wakefulness. It is also the seat of how you intake all of the information. It's the thing that gives you the comprehension of how you're parsing information when it comes in. And so your brainstem injuries are often the most life-threatening of all of your TBIs or your traumatic brain injury for presentation. So there are other things that are in here and that I think are super important, but I want to fast forward to the physics and the impact of trauma. Okay, and you can always stop the slides and go back and read and whatever you feel like is super important. But the reason that, go ahead, sir.
Charlene, real quick, I want to ask a question. When you mentioned the left and the right side of the brain, as you know, when we discuss the physicality of men and women, the right side, as far as men are concerned, it is usually connected. They say it's 80% of the male side is masculine, and 20% of the left side of a male is feminine, and just the opposite with a goddess or a queen. So could you explain why it is such? Could you give us a little rundown on it, if possible, sister?
Of the right side and the left side, or the masculine and the feminine? The
masculine and the feminine, because you said the right and the left side of the brain, which I'm sure that would affect the label that you give in terms of the physicality, the makeup of a male and a female, correct?
Yes and no.
Okay, I'm listening.
I will say this because that's a completely different conversation, and independent of us having a discussion about how the brain works for injury, now we're talking about how the brain works, the chemical aspects of the brain. So we have, the good news is we have two aspects to the brain that's important for you to note about the human body. We have the chemical aspect, and we also have the electric aspect. So our brains work in both dimensions. It works chemically, but it also works electrically. So when it comes to the male and the female as it pertains to how much hormones that you have that are actively working in your brain, I cannot speak to that. So I do apologize. My wheelhouse is really with regards to impact and trauma and the injury of the brain, not male and female and feminine and the masculine aspects of it.
Okay. My bad, sis. I didn't mean to jump ahead. Okay, I thought it might be relative. Okay, but let me be quiet. Let you finish your presentation. My bad.
No worries. No worries.
I have a question. Did you start to share the screen yet? Because I didn't see any slides. I just wanted to make sure.
You haven't seen anything? Yes, ma'am, I did.
I see your it says Charlene T. Harper screen, but I don't see like any pictures. There's a picture of a beach, and that's it, not the actual slide.
Can you see it now?
No.
Okay.
If it's, let me.
Hold on. Let's see.
And if it doesn't show, that's okay.
Let's see. All right, I have no problem. Let's see. What about? Can you see it now? All right, hold on. Let me get back to.
It says here, select items to share.
All right, so no worries, no worries. Let me get to where it is you guys are.
Okay,
right.
something moved.
Okay, so I apologize.
That's okay.
So can you see the huddle picture now? Meeting wall huddle team. Can you see anything?
So what I see, it says there's like a beach. I think that's your screensaver.
Yes, it is.
Is there like a beach
okay,
or
so
water?
Let me go back.
Now, when I click on the share screen,
yes,
there's a list, and it says select items to share. Now, I don't know if you need to click on that and then share.
Okay, hold on.
If it doesn't work, don't worry. We can continue on with the presentation.
Okay, let me just at least see if I'll give 2 seconds to see if I can figure this out. I'm trying to get back to where it was that I was with the huddle team. I'm sorry, I'm a Zoomer. And the huddle team is something that's very, very new for me.
Same here.
Okay, so I will select the items to share. So, okay. So I just put yes.
Arlene speaking.
Okay.
So, Arlene, right. if it doesn't go through this time, we just move on.
Okay.
Mm-hmm.
All right. I can't figure out how to get it.
Don't worry about it, sis. We'll do it next time, but we'll send you a copy of the show. So go ahead, sis.
Okay.
All right.
And I saw something now. I don't.
Yeah, but we'll move on, Arlene.
Okay.
If you don't see it, sis, I appreciate it.
All right. No worries. No worries.
Thank you, Arlene. Appreciate it. Thank you.
Now I see the huddle screen, but okay, we'll move on.
Okay.
I see it now. The physics of impact trauma. Yay! I see it now. Yes. Right as Brother Forrest said, we'll move on.
Hip, hip, hooray. All right. So
good timing. Okay.
Information in mind. I'm going to go back. Go back. Hold on.
Gotcha.
I'm going to go back just so that you guys will be able to go back.
Fine.
And take a look at the presentation. You can stop the slides and you can read them, okay? So we're just understanding the brain. This is a quick review for Chapter 1. Mm-hmm. I talked about the architecture of the brain, the 3 main pieces, cerebellum, the cerebrum, and the brain stem, right?
Okay.
I talked about the cerebrum being the command center.
Absolutely.
The 4 lobes and what they control, right? Mm-hmm. I talked about the cerebellum and the brainstem, the life support duo. Mm-hmm. And then I discussed the brain's interconnected network, but I have another slide for this, so I'm not going to go back. You can certainly go back and read about that.
Of course.
And then we are now in the physics of impact and trauma. Okay? All right. Thank you so much for saying something because I was happily going on.
That's okay.
Okay, so the question is, since my wheelhouse is in car accidents, the question is what happens inside the skull at 40 to 80 miles an hour? And the reason that I picked the 40 to 80 miles an hour is because 40 miles an hour, we have a tendency to perceive that as being really, really slow. And 80 miles an hour, we have a tendency to perceive that to be really, really fast, right? So what happens is when you get hit, the brain undergoes a sequence that obviously it unfolds in milliseconds. The skull stops. The skull is separate from your brain, right? So the skull stops. The brain is suspended in your cerebral spinal fluid, your CSF, but that doesn't stop moving, okay? So when you get hit, your head strikes the surface, and I also want to say that even if the car gets hit or if the bike gets hit, your brain still has a tendency to manage or have an impact, okay? So your skull will decelerate violently, meaning if you hit something, your skull smacks whatever you're hitting. The brain is still moving at impact velocity, and it crashes into the inner skull wall, and you end up with a coup injury. So at the end of the day, when I'm talking about your brain, if you can still imagine that peanut in a can, if the can is your skull and the can gets hit, it's going to rattle the peanut in the middle. Does that make any sense to anyone?
Yes.
Okay. So now we're talking about the rebound. So the rebound is kind of sort of the reverb, right? If you hit, even if you play a guitar, if you pluck the string, the string moves back and forth very, very fast. Well, the brain rebounds and strikes the opposite wall of the skull. So everything happens in the opposite in the brain, not only for injury, but in terms of even commands, right? So if I'm lifting my left hand, my right brain is controlling everything on the left. My left brain is controlling everything on the right. And so when you get hit, let's say you get hit in the front of your head, the back of your brain is going to hit the back of the skull, and then that peanut in the can is going to continue to go back and forth until the impact is null, right? Until it has stopped. So when you get hit, you're going to get hit at anywhere between 60 to 110 G's mile per hour. We actually have G forces, meaning the speed of 60 miles an hour translates to 80 to 100 G forces. So with regards to oscillation, I'm talking about the reverb, about oscillating back and forth. So it will oscillate 3 to 5 times before coming to rest. And so that is incredibly important, because even if you're in the car and you don't hit your head, the brain will still move. Why? Because it's located inside fluid. That peanut is still in the can. If you hit something that hits the can, that potential energy is still transferred. Okay. So you also have the last slide on this particular page is talking about rotational shear. And so basically the brain also has the option not only to get hit from the frontal angle, but if you get hit, let's say you get hit around the driver's side car, it spins. It spins the car, but it also spins your brain. Okay? And so spin is harder to heal than to hit dead on or straight ahead. And the reason is because there are the rotational shear has a tendency, like when you wring a towel to get the juice out, right? Or the liquid out. When you torque things, then things get tangled. Okay? So moving on, the whole point of having this conversation is because G-force matters. And even if you're on a bike and you get thrown from the bike and you hit your head, right? That's why we now have to wear helmets. There were a lot of times where we didn't have to wear helmets at all. But I want to talk super fast in terms of brain injury. So if you get a little teeny bump on your head to a catastrophic injury, it's only going to be, I'm only going to talk about 5 levels today, right? So level 1 is a minimal to catastrophic, right? Or level 1 is minimal. And that means you get a minor bump on your head or a subconcussive hit, no LOC, which is a loss of consciousness. You're briefly disoriented. You know, the symptoms kind of resolve in hours. And the best example of something like that is getting out of the car and hitting your head on a part of the car door. Okay? You got a minor bump, there's no loss of consciousness, and you end up resolving. Okay? Level 2 is the mild TBI, which is a traumatic brain injury or a concussion. So if you lose consciousness under 30 minutes, meaning at any point in time that you lose consciousness, now you're automatically having a concussion. So my definition of a concussion when I was younger was I thought that you had to, have a major head impact, and that loss of consciousness wasn't even necessarily on the table, that if you really, really hit your head pretty bad, then you were automatically, you automatically had a concussion. But that's not the technical definition. So PTA is post-traumatic amnesia. So if you really hit your head and you have a loss of consciousness under 30 minutes, you're going to end up, what's normal is that you're going to have some post-traumatic amnesia, which means your brain needs some time to reorganize, to get everything back together. Okay? Level 3, and I'm going to go through super fast so that I can get to your questions. Level 3 is a moderate traumatic brain injury. That means you have a loss of consciousness from 30 minutes to 24 hours. That's a whole different wheelhouse, because what it does for your post-traumatic amnesia is that it extends it from 1 to 7 days. So if you really get hit, let's say you get hit in the car and the bag deploys, and you lose consciousness for a little while, when they take you to the hospital, you may not remember your name. You may not remember your partner. You may not, and those things are normal, because the brain has been injured, and it takes some time to be able to reorganize so that it can do retrieval. Initially, it's all about recovery. It's all about, and sometimes the brain starts to swell, and you need some surgical taps put in to help manage the swelling. But the point of the matter is, if you are conscious, it greatly and drastically reduces how the presentation for your injury is. Does that make sense? Level 4 is severe traumatic injury, loss of conscious over 24 hours. And that means that you have to go to the ICU. And the last one is a catastrophic or a vegetative state, which is a prolonged coma. The brainstem has been injured, and there is a minimal consciousness, which is usually a level 5. Okay? Now, the good news is that the body does understand how to heal, and but I just wanted to give everybody a some understanding of what the levels are. And usually, if you are riding a bike, if you're playing football, if you are, playing pickleball, or, if you're playing basketball even, or hockey, those are usually the 1 to 2s. So, and it's really classified by loss of consciousness. Okay, so if you are lights out, or if you are in boxing and you guys are fighting, and the next thing you know you're lights out, concussion is automatically going to be on the table. Okay? So I do have a slide here that talks about what technically classifies as a brain injury. So you are certainly welcome to circle back and read that. I wanted to talk super fast about how the brain injury manifests. So what exactly are the 4 domains or the 4 signs and symptoms that you actually have a traumatic brain injury?
Charlene.
Yes, sir.
Let me say this. Hold on to that 4, because I'll remember it if you don't, but I know you will. Just in case, because there's anybody that needs to ask questions from this point and then going forward in your finale. Let's see if anybody just has any questions, because sometimes, they might snooze a little up here. So, family, if you have any questions for our dear sister Charlene Harper, all right, pertaining to our brains and brain health and what she's run down, by all means, please take yourself off mute and ask the questions now before she gives her final presentation up here on the network. And once again, we'd like to thank Charlene for coming in. So come on, family. Anybody like to ask any questions or comments for Sister Charlene?
Good evening.
I do. This is Sister Lori from Chicago. Sorry.
Okay.
I have a
one at a time, ladies. Don't beat up on each other now. Come on.
I have a question about recovery time.
Yes.
The recovery time versus the electrical versus the chemical. And I need to know what's the recovery time for some brain injury clients. You know what I mean? I don't know how to ask it, but what I noticed is there's some slowness that happens over time. Is it 6 to 8 weeks, 6 months for recovery?
So the question is, what injury are we talking about? Are we talking about grandma hit her head on the cabinet, or are we talking about you and grandma and the kids were in a car accident? Nobody hit their head.
Something simple. Grandma's head hidden on the cabinet. It doesn't have to be grandma. It could be anybody, an athlete or anything.
That's right. That's right.
But I just wanted to know, curiously, what is the recovery time? And I didn't mean to bump anybody else off, but I know this is important to all of us. But I just was curious about the recovery time for that type of brain irritation, you know?
So one of the things I think is the most important is checking in with your family members on a regular basis. Why? Because you become the person that can establish a baseline. A baseline is the speed that you normally are conversing at. The speed that these are the details that the doctor is going to want to know. So if you checked in with grandma and you guys talked on a weekly basis and all of a sudden you were aware that her speech is slower, and she said, you know what, I hit my head yesterday and I don't really have a bump, but her speech is slower, her vision is impaired, her ability to, if you ask her where her slippers are, and she's having trouble remembering where she put them, or if she doesn't recognize her slippers, that's when you know that we have a challenge where we actually have to go to the hospital. But the answer to the question is it depends what part of the brain is damaged and whether or not you are giving the brain proper nutrient support to heal. Does that make sense?
Lori?
Yeah. I'm sorry.
Lori, are you there? Wait a minute. Please do not speak out of turn. Give the sister time, a chance to come in. Go ahead, Sister Lori.
Yeah, I am one. Yes, that's really good, because when I was experiencing vertigo, and it was just like from out of nowhere, and I said, okay, there's got to be a method to recovery. And so the doctors weren't telling me how to recover. I just remembered that the body has a time period where it heals itself with nothing in it. And sleep was the first thing that came to me. So I did the sleep therapy, and I'm still working on it now, but it was 7 to 9 hours sleep. And within, I would say, about a month, it seemed like I almost miraculously recovered. recovered from that. And now I'm eating like a whole lot of lion's mane and everything that has to do with building up my brain muscles. You know what I mean? Because that's, I didn't know. I just did it. You
mean your processing speed, because the brain doesn't actually have muscles, right?
No. Well, yeah. But I'm just saying that it just, I'm so used to working out. But the thing is, it's like the recovery time. And I noticed that people wanted to give you pills and all kinds of stuff, but they never said anything about the chemicals in the pills. How does it affect you? What's your reaction time? What's the side effects of them? They didn't say anything about it. But what I remembered is the sleep part of it. And so I tried it, and the sleep part worked. And then a friend of mine mentioned to me about eating lion's mane. Never heard of it. And I tried it, and it has no flavor in it, but it really helped a lot. So thank you for that, and I'm going to study that more. Thank you so much.
Absolutely. So remember, we have two vectors of healing, right? We have the regular hospital where you go to the regular doctor. So again, the best explanation I can give between the regular hospital or the allopathic side of medicine and the naturopathic side of medicine is if you break a leg, no amount of broccoli or supplements is going to fix the leg. So it does have a place in the healing journey for the human body. But then there's the naturopathic side, which they're actually not allowed to discuss, and that's the side that re-nutrifies the body. Okay? So the only challenge that I have with people who are taking supplements is that you be followed by somebody that can tell you when too much is too much, right? Because being overdosed has the same, and everybody says, I'll just say it this way, many people don't understand that when you overdose on a particular supplement, it doesn't look like Law and Order SVU, right? It doesn't look like that. What it looks like is you're having a brain impairment and you weren't hit, and there was, even extreme dehydration can cause you to appear to have a brain impairment. But there are UL levels, which are the maximum toxicity for each element that you are eating. So just be mindful that there's also a piece called the half-life or the full life of the medicine. So you take the lion's mane, and then the question then becomes, how long does it take to cycle out of your system before you take the next dose, right? So just be mindful that that the nutraceuticals are extremely powerful, and they have a longer life than those that are dried down into powders that we take in pills. Okay? I hope it's helpful.
I have a question.
But wait a minute. Hold. Is this still Lori?
Yes, sir.
No.
Thank you, Lori.
No.
Okay, wait a minute, because I hear many people talking. Hold on, because Sister LaToya was next. But, Lori, is this you?
Yeah, I just was saying thank you and how grateful I was for the broadcast.
Oh, okay. Well, thank you, Sister Lori, because, I know we got some people standing behind you and LaToya, but always thank you, Sister Lori. Appreciate you coming in with the question. I hope you learned a little something, because I have. All right, Sister LaToya, step up to the plate, sis. Come on.
Good evening. And your guest name is, I'm sorry, I just lost my train. Your name is again, ma'am?
I'm Charlene. Charlene.
Okay.
Yep.
Good evening, Charlene. So, for me, I was born with a birth defect. I was born with spina bifida.
Uh-huh.
Yes. So being born with spina bifida, as a child up until still as an adult, always protective of my head. So, yes. So, for me, them prescribing me painkillers.
Mm-hmm.
Ibuprofen, Excedrin, all that Tylenol, all that over-the-counter stuff.
Mm-hmm.
So I had to remove myself off that as my pediatrician. She took me up until I was an adult, until she had to stop taking me. So I had to learn how to do something else in order to stop the pain. that I was going to do because I had a lot of body ache from head and down. So I started meditating because I refused to take medication. So that's what helped me. Meditating. I put myself in a soothing spot and meditating, and that's what helped me. I was removed for gym. They excused me to the gym because of my birth defect. So I was exempt for gym because of the balls, throwing different places. So I was able to be in gym, but I just couldn't play basketball, anything like that, or any type of. But I was able to play as a child, but that's the only thing.
Did you have a question?
Oh, so my question is, maybe I might be a little different. So I did I did fall. I fell on Mother's Day and hit the crown of my skull. Yes, and I had to go to the hospital. I didn't go at Mother's Day, but eventually I didn't go. And eventually they did keep me, and they just told me I had to stay, and they wanted to do more further examination, and I told them no, I had to go. Yes.
All right. So is there a question for Sister Charlene, LaToya?
Yes.
Okay, go ahead. Ask the question, sis.
Yes. My question is, Kadena, you're talking about brain. You're speaking about it. So what is best for that? You're speaking about brain, being because I'm born with a birth defect. Is that a part of the topic, or am I totally off the topic?
Oh, you're asking about the brain? Yeah, so it's a question. So maybe Sister Charlene could answer that question if because
I was experiencing excruciating headaches. Yes.
Right. So you asked her what's the best remedy for that?
Yes, I was experiencing excruciating headaches from
right.
that. Yes.
So Sister Charlene, what do you say to that?
So, two things. So, for the benefit of our listening audience, spina bifida is a birth defect, and the baby's spinal cord it doesn't develop or close completely in utero, and so what it means is electrically it means that the circuit isn't able to form a complete circuit, but it also means that chemically that there can be some challenges with being off. So the long and short of it is, electrically you have a challenge turning the pain receptors off. And so at the end of the day, the brain's ability to interpret pain, because the light switch isn't working to turn all the receptors on when there's an issue and all the receptors off, then the way of being able to gauge the pain is a whole lot more challenging to be able to explain, right? So when you go and you hit your head and you have a challenge with the electrical aspect of yourself, is it something that is it an outrageous expectation that you would have a physiological response to hitting your head? Absolutely not. That's normal, right? And so the question then becomes, how exacerbated is the pain, and whether or not there was a major injury to the brain itself. And so because I'm not a doctor, I'm not allowed to give any types of diagnoses or major recommendations. But what I can say is, if you are having trouble seeing, if you are having trouble hearing, if you are having trouble comprehending or understanding, there is a traumatic brain injury on the table. If you are having vertigo, And vertigo has 11 different symptoms that doesn't always involve spinning. Sometimes it involves the eyeballs going back and forth and back and forth. If you're closing your eyes and your eyeballs are still moving and they're not stopping, then that is a sign and symptom that the brain inner ear crystals have been dysregulated. So what I can say is the best thing for you to do is to write down your signs and symptoms and put down the time that it's happening, because the doctors can't help you without data. They need some data points to be able to have effective assistance, and that means that even the naturopathic doctors, they need data as well. So if you are having any type of brain compromise, you must write these things down. I stared at the salt, but I didn't understand what to do with it. That's a major problem. I stared at this object. I'm positive I use it every day. I didn't remember it was my toothbrush. That's a problem. That's an indication of a major brain impairment. Does that make sense?
Yes, it do, ma'am.
Okay. All right. So that's
okay, well, let me say this. Latoya, thank you. I just want to see if anybody's standing behind you, sis, so we can get these questions in.
I do.
To the clock. I want to thank you, sis. Thank you so much, Latoya.
I want to say thank you for breaking it down for other people to understand. But thank you. You answered my question, and I do pay attention to my body. But thank you so much.
Thank you, Latoya. Appreciate it. All right, anybody else? Questions or comments for the sister, because she has to finish her presentation, family?
I got a question.
Good,
okay, for those of us who are up in age, with the great information that you've given us, should they learn that they've been injured or they have a brain injury, what is your suggestion on them being able to call 911? How should they, because I'm quite sure if they know that they have a brain injury, you may not recommend that they're walking around and moving around. How should they, or what should they do to get themselves some help?
Well, I definitely have that in my slides, but I will answer your question to say that the good news, I have good news for you, and that is that the human body is a tattletale.
Okay.
The human body is a tattletale. So if somebody is sleeping too long, that's going to be a massive problem. You know what? Actually, I'm looking at the 4 domains of traumatic brain injury symptoms right now. So, for example, if you called 911, if you called your daughter and you said, I hit my head, and she's going to ask the question, well, how are you feeling? And you can say, the first little slide I have is physical, and so it says, basically, they're going to ask you how you feel. Do you have a headache? Are you nauseous? Are you vomiting? Are you dizzy and unable to stand? Do you have a balance disturbance, meaning is your gait off? Do you have blurred or double vision? Do you have tinnitus, which is the ringing in your ear? Are you extremely fatigued? Do you have a light sensitivity or a sound sensitivity? Does your neck hurt? Right? Those are the major pieces, and if you usually answer yes to more than 3, then you really should get checked out. There's a cognitive aspect to this, so that means, do you have difficulty concentrating? Do you have a much slower processing speed, which is what I was talking to you about, talking to your kids at least once a week so that they can have a good read of where you are cognitively, even if it's every other week. Somebody that you guys are close to, if it's not your kids, it can be, a best friend, or it could be, a family member. Somebody has to understand what your brain baseline is so that they will know that if there is a memory gap, or if you're constantly confused, or if you cannot find your words, more than just, I don't remember, the name of my best friend in kindergarten, right? I'm talking about you just came out of the bathroom and you don't remember what you did. Not, I don't remember where my glasses are, but I don't remember how many pairs that I have. You look at the glasses and you don't know what they're supposed to do or where you're supposed to put them. A lot of times if you automatically know that somebody's in trouble if they are sitting down at the table and you hand them their glasses and they begin to eat them, right? So you automatically know, okay, we've got to go to the doctors. Does that make sense?
That makes sense. So now, next question. Maybe I watch too much TV, but I'm going to ask anyway. So should someone recognize that they have a brain injury based off of the information that you've given us? I know it's going to take a while for the ambulance to get here. Is there such thing as like maybe putting cool water on your forehead or behind your neck or something like that to kind of keep you stable until nothing?
I wouldn't leave them, because if somebody is exhibiting these signs or symptoms, they're not going to be able to regulate other portions of their body. Usually, they will begin, my next little portion on the slide is emotional and behavioral. They'll get irritable. And a lot of times they're not so much getting irritable with you, but they're getting frustrated with themselves. They'll say things like, come on, Charlene, what are you know what this is, or you can recognize this. It ramps up anxiety, depression, emotional dysregulation, personality changes, social withdrawal, and then at the end of the day, if they cannot sleep. Now, that's a hard one for seniors because many of you guys can't sleep anyway, but this is a little bit different. This is you either not being able to sleep at all or you sleeping far too much. Like if it's breakfast and you're just waking up, it's 7 o'clock at night, you went through breakfast, you went through lunch, you went through dinner, and now you're just waking up. You can only stay up enough time to go to the bathroom and get back in the bed, and then you sleep for another 10, 15 hours. That is a sign and symptom that something is very, very wrong. So if your senior or if your friends are missing meals, if they are not answering your phone calls, if they are slurring their speech, if they are breathing, or if they're crying incessantly, sometimes you cannot articulate that things are wrong, then they need to get some help. Does that make sense?
That makes sense.
Okay.
Thank you very much. And 1 second.
Sure.
Brother Forrest, it's 7:13. I'm not sure what you want to do with the time. Brother Forrest. Did he hear me?
Yes, I was on mute. Can you hear me? Mic check. Can you hear me?
Yes.
I was on mute. Sorry about that, sister. Yes, I was listening. Okay.
That's okay. It's 7:14.
Okay, we got time because Elle won't be coming in, Sister Arlene. She's under the weather. Yeah, so we got a little time. I appreciate it. All right. Okay. So, yes, go right ahead, brother.
Grand rising to everybody on this line. I come on this line and others in peace.
All right.
I would like to ask Forrest, I want to make a statement, but then I want to ask Forrest a question before I ask your guest a question. Forrest, I so bad wanted to jump in to try to help y'all with the screen thing that y'all was having a problem with, but every time I've jumped in the past to try to help out, you get ridiculed because people feel like they know what they're doing, and for a fact I know how to work this app just about better than anybody.
Well, for the record, I didn't ridicule, and you're right, brother, and Arlene knows how to work it. We finally got it under session. Appreciate that, brother.
Yeah, no. I see that, but I'm just saying she was on point. She was on point on God know how to do that. You just know, it would have been right there on time. Listen, I want to ask you a question, Forrest, so I can ask your guest. What was the condition that Adrienne had? Do you remember?
No, I know she had a few, but I can't recall.
No, I'm talking about the brain injury. She had a brain injury.
Oh, no, I don't recall, brother.
Okay, all right. Thank you for your information, Miss
Charlene. Sure.
Miss Charlene. Wealth of information. I wanted to ask you about this other brain injury to see if you knew about that. And I like how you alleviated yourself from answering the question. But how you can alleviate from asking yourself a question is just make the disclaimer before you start doing your presentation. And that will alleviate you from, avoiding asking the question because, like you said, you're not a doctor, an MD. You ever heard of a brain injury that when you were little, what it doesn't do, I can't think of the name of the disease, it's on the tip of my tongue, that it doesn't allow blood flow to get to the middle of the brain. And it will cause you to have seizures, epilepsy, strokes. It could have a stroke or a heart attack. Do you know the disease I'm talking about?
I know the signs and symptoms.
Okay. We had a young lady up here who used to have her own podcast, and she'd always would tell us half her brain works. And they used to tell her she was an anomaly because half her brain worked, but none of us really understood what she was talking about until she passed away. When she passed away, then you found out that she had this brain condition. I just can't think of the name of it, but I just want to thank you for your presentation. I've been up here listening since the beginning, and thank you for your professionalism, and I rest.
Thank you, Brother Leon. Appreciate you, brother, as always. Trying to do better up here. All right. By the way, is there a rebuttal you'd like to give to Brother Leon and their sister Charlene?
No, sir. There's without enough information. The challenges that we as medical professionals have. There are so many different challenges that can intersect, and without enough data points or information, I would just be guessing. So, because
they're like overlap or concurrent with other issues, I guess.
Ma'am.
Right, that's true. All right, anyone else? Come on, step up to the podium, our dear sister here, because she does have to finish her presentation. We're very grateful and cognizant of her time. Anyone else? Question or comment for Sister Charlene? Okay, so I know because we have quite a few people up here, sis.
No
I'll let you finish your presentation because I know you were talking about. I know number 4 was in there somewhere, so go right ahead, sis.
So we are now talking about step-by-step self-assessment after a head impact. Okay, so let's say you're by yourself, and you fall down. So number 1 would be an immediate check or a self-assessment, right? Number 1, did you lose your consciousness, even briefly? And how do you know that you lost your consciousness? Well, if your vision goes offline and you don't remember what happened when you hit your head, which is common, right? It's not uncommon. But when your vision goes offline, that's a good indication that you've lost your consciousness. If you are confused about what day of the week it is, where you are, or what happened, and can you recall any events before or after? How did you get here, right? If you have no idea who you are or where you are, or if you are confused about what's happening, you may have experienced some post-traumatic amnesia, PTA, right? So that means you got to get some help. And the good news about head injury and head injury traumas is that if you get, it's early intervention, right? So if you get help as close to the injury as possible, then you can get, the intervention can save your brain, all right? So number one was the immediate check. Did I lose my vision at all? Did I lose my consciousness, right? LOC. Did I have an issue with LOC, loss of consciousness? So for the symptom number 2, your injuries, do you have a headache? Rate your headache from 1 to 10. Are you nauseous? Do you have any visual changes? Ringing of your ears or balance problems. Now, that is an important aspect. Why? Because we have little inner ear crystals that hang down, kind of sort of like long earrings. And when you tip your head to the side, or if you turn your head, they're like stalactites, right? They hang down, and based upon your head orientation, they move the way that your head is moving. So they feed information to your brain about where it is, what the location and positioning of your head, right? So what I had on my 8th car accident, I had most of my inner ear crystals scrambled. So I used a wheelchair. I could barely see. My eyeballs were crossed. Like, I was in tough shape. But it's super important to be able to know if your eyeballs are crossed and they're not uncrossing, or like I could see but I couldn't focus for 18 months. And what they do is they take you and they put some goggles on you so that they can figure out which inner ear crystal, which side of the brain has lost its ability to maintain orientation, right? So the good news is, this is in 15 to 30 minutes after a head trauma, this is the time that you call your friend or you call whoever understands your baseline, and you're like, hey, I just got hit in the head, and you can tell them most people can't articulate what happened. So they have a tough time being able to relay the events. All they know is that something is wrong. And sometimes that's the only sentence you can remember, is that something is very, very wrong with me, right? And so if you hear your loved one saying something like that, the first question that you as the caregiver or as somebody who is not impaired, you say, if grandma calls up and say something's wrong with me, the first question you ask is, did you hit your head? Did you fall down? Sometimes they'll say they don't know, and you say, oh, did you wake up on the ground? Because if you woke up on the ground, then you see you fell down to get there, right? Are you bleeding? Do you have a headache? Did you throw up or anything like that? If they're capable of answering anything, you really need to get them. That's when you would call 911. So we have 2 other quick pieces to your self-assessment cognitive probe. Can you recall 3 objects named to you 5 minutes ago? Can you count backwards? But those are usually medical professional questions. And then the last one is symptom tracking, which is usually 2 to 72 hours. Your traumatic brain injury symptoms will worsen at 12 to 24 hours, meaning usually people don't want to be a bother when they have a traumatic brain injury. And they're like, no, I'm okay. And then they go to lay down. But if they wake up, or if they're unable to sleep, or if they have a major issue and it's just getting worse, they have to get help right away. Okay? I hope that was helpful. I'm going to cycle through. I put some red flag symptoms in the presentation when the call 911 versus when to go to the ER. So I'm just going to roll through this. You guys are welcome to read. There is medical diagnosis and acute care. I will just tell you this. If you go to the ER, they're going to triage you, and they're going to give you a Glasgow Coma Scale exam. Basically, they're going to see how your eyeballs are tracking. They're going to see if you're able to speak or how you're able to speak. And they're going to give you a quick motor response test, okay? And then they add those numbers up together, and if you're in the mild range, then, they'll give you a set of instructions. You can go home. If you're in moderate range, you're not going home. And if you are in severe range, you're not going home. And that just means further testing about which areas of your brain is a problem, right? And then you go to the CT. They'll give you a CT. They'll give you an MRI, and more importantly, they'll want to see if your numbers are super low for your Glasgow Coma scale. Then they'll monitor your cerebral spinal fluid and your eye pressure and then lastly a neurosurgical consult for whether or not you're going to need surgery. Okay, so in a nutshell, healing the injured brain happens on a number of different levels. But before I talk about healing, were there any questions that I had so far? Did anybody want to ask any additional questions? No?
Charlene?
Yes, sir.
Let me conduct that, sis, because you get 5 people talking on the same time. Okay.
Thank you for
come on in, all right, come on in, family.
Thank you for the presentation. And I was in and out. I was listening, but I got the phone calls and I couldn't not answer them. So maybe I'm already asking for things which would have been taught in the presentation. I've been in several injuries. I think I don't know how severe it was and what that was. Those things were years ago, but I don't know what the long-lasting consequences of that. Am I still suffer from that? One was when I was about maybe 5 years old when I fell on the ice and I hit the back of my skull.
Mm-hmm.
And since then I was having like some issues with the hearing. I think I've been having issues with the hearing before, but then it was some kind of another factor with my hearing. Another one, once I was climbing up with one of my machines, I was going backwards and I was wheeling the buffer, and at some point the handle of the buffer was not attached well. I don't know how it happens. I always check my equipment, but it happened, and I hit the machine run of the steps, and I hit the back part of my the edge of the stair hit my back of my skull.
Mm-hmm.
Question, Vito. What is your question, brother?
My question is, well, I have, let's say, many things, including like my decision making and of that could that be a consequence of that injury from my childhood
Okay, so do you want me to answer the question?
Pardon me?
Do you want me to
answer your question, Vito?
Yeah, if please.
I would love to. Okay, so I have good news for everybody. What people really don't understand, and I didn't, working in the field, I had a much different understanding about the brain injury field and what it means to have a concussion and how to live in being post-concussed for 18 months. What the head neurology chief at Mass General Hospital, when I told him that I had 8 concussions, he said every single time you have a brain injury or a concussion, your brain reformats. So in other words, when you have a brain injury, if you're in a car accident and you don't get hit, every single time you're in a car accident, you end up with a concussion, whether you hit your head or not. And so if you've hit your head before, or if you've been in any car accidents, what happens is your brain, it reformats. And the best way to say it is, if there are areas which are off limits until they can be repaired, your brain has a tendency to reroute. But if you have 8 concussions like I did, what happens is each time the brain reformats and reformats and reformats and reformats. And so you really do need to go to rehab to untangle the directions to get to your house. Does that make sense? So let's say the GPS in your head, let's say you want to go from school to home, and the first injury 2 blocks from your house, that street is closed. So then you reroute, but you never get that first injury fixed, right? So now you no longer even remember that you can use or access that street. So that street kind of sort of remains closed off. And then you had another head injury, or you had another car accident, and let's say you had 3 or 4. Now you still gotta get home, but now you have a number of accesses or ways that you get home. Those 2 will be kind of sort of cut off. Now, does it mean that we don't have the ability to access neuroplasticity? It doesn't. Your brain will always have a capacity to rewire, but it's like puppet strings, where it doesn't always rewire to the best ability, right? And sometimes those wires get a little bit crossed. It gets crossed in reading. It gets crossed in language. It gets crossed. It will heal, but sometimes the way it's healing or the understanding of what it needs to do gets crossed. And you can end up with more headaches because, your brain is trying to go from school to home, but the directions are a little bit crazy, and it's up and down and it's all around, and you don't realize that, that first injury was healed, so you could literally it could be a straight line. So processing changes. The sum of what I'm trying to say is your processing changes every time you have a head injury, whether you were in a car accident or not.
Okay, Vito, you complete, brother?
Sort of.
Okay, the reason why I asked is because we have another question real quick, because remember, Sister Charlene has not finished her presentation. But go right ahead, Vito, real quick.
Yeah, very quick. I mean, a friend of mine was in a terrible airplane accident years ago, and I didn't know him of that aspect of him. He was his daughter told me recently that he was that in the family life he was abuser. I was wondering, would that be also kind of side effect of that accident?
You saying a physical abuser?
Yeah, he was both physical mainly, but both all aspects, I guess. Yeah.
So there are times when your personality does change when you get hit in the head. So it's actually one of the major signs and symptoms that there is something very, very wrong with you. But usually the marker or the benchmark is you look at how your behavior was before the accident, and
Right.
then you look at behavior after the accident. And if the disparity is really big, then you should get some help to help you circle back to get where it is that you were. Sometimes you can get very, very close.
But hold up, sis. Arlene, do me a favor.
1 second, I'm gonna.
If anybody, hold up. If anybody is making noise, mute them, please, Arlene. You can see the symbol jumping. All right, family, come on. Stop. My guest is talking. You're being disrespectful. Don't do that. Go right ahead, sister.
So basically, the question was, does brain impairment affect your personality? And the answer to that question is yes. You can have a drastic personality change by hitting your head, and that is normal in the traumatic brain injury space. And I don't just mean, excessive crying, or I don't just mean, excessive anxiety. I'm talking about somebody who was super nice that becomes incredibly cruel. I'm talking about a drastic change in behavior. And so those things need to be diagnosed by a physician and are often indications of traumatic brain injury.
Yes, I have a comment. In regards to what you just said, I've seen, this was years ago, where someone...
Arlene.
Yeah.
Real quick, I just want to make sure Vito rests, and we'll bring you right in. But Vito, I just want to say thank you for your questions, brother. And we're going to have to move along because, time is a factor. So thank you, Vito. Go right ahead, Sister Arlene.
Absolutely. Thank you. Thank
All right, thank you, brother.
Sorry, I was in a noisy place.
No, that's okay. Don't worry about it, brother. It's okay. Sister Arlene, go right ahead, sis.
Thank you.
Thank you, Vito.
Thank you, Vito, and I apologize for that. But in regards to what Charlene said, I did see, this was over 5 years ago, so please forgive me. But this gentleman had an accident and he hit his head. But all the friends, so he didn't realize that his personality changed. But all his friends started to complain because he became a not so nice person. Mm-hmm. And one thing they were all saying is that he wasn't like that before the accident. And that's what had them suggest that he go get checked. But anyway, to make a long story short, he did get checked, and they found something had happened where he had to actually have surgery to kind of rewire the brain. Mm-hmm. And after the surgery, he was back to his nice self. He was a nice guy. Mm-hmm. And, he became not so nice after that injury. So I just wanted to say it's a real thing.
But Arlene, on that point, I want to ask Charlene to piggyback off of what you said. When they open up your head like that and air hits the top of your brain, because I know a friend of mine who had a brain aneurysm and they had to go into his head. Isn't that kind of leading to like future problems with your brain? Even though, like Sister Arlene said, a friend got rewired in his brain. What are the chances are that you will not probably going forward suffer from anything from them really opening up your head and going into it?
Well, part of the challenge, I think, with regards to brain surgery is there are a number of different pieces on the table, right? There is the actual surgery itself and the actual expertise of the surgeon. And then there is the nutraceutical aspect. How do you support brain health once you have surgery? You have to go on different diets. You won't be able to do, the Thanksgiving mac and cheese and, tons of pork ribs. And, you're not going to be able to eat like you used to eat when you have brain impairments or surgery. Mm. So there are a million different variables that can lead to the brain not being able to heal. Lack of sleep. Maybe you have kids in the house and all they do is scream and cry. maybe you have a newborn, maybe you have no help, maybe you have, so the variables are endless, right? But there are ways when you deal with a medical coordinator, and I happen to be one. When you deal with a medical coordinator, we coordinate your medical care, and we do the work to make sure that you have a platform that makes sense, that you have support at home. And that's actually one of the criteria of if you have a traumatic brain injury and you're in the hospital, they will make a determination about whether or not you go into rehab based upon whether or not you have some assistance at home. So, the one of the most important pieces of any surgery at all, kind of sort of like you can't fly and dive in the same 24 hours. In the first 30 days, no matter what kind of surgery you have, you cannot fall. And the reason you can't fall is because the hospital will charge you the entire amount of the surgery. People don't know that. So you really need to do the work to make sure that people are getting some help. The hospital does not get paid with the second surgery inside of 30 days. So you make sure you get some help so that you don't end up with mortgaging your home in order to have a gigantic bill. Okay?
And thank you for that, Charlene. And did y'all hear what Sister Charlene said? All right?
Yes.
From the two examples she gave of what you're putting into your mouth and your stomach, sound like processed food to me. We always talk about that up here with the healers. So I'm going to end this talk by asking the sister, after we finish with you guys, to make sure you're good and complete on your end, my participants.
I have.
Are there any other? Wait a minute.
Sorry.
Ho, sister, hold on for a minute, please. Now, if there's anyone who hasn't spoken that would like to ask a question or make a comment, hold on, Latoya, and then please step up to the podium. If not, Sister Latoya will go next, and then we're going to have Sister Charlene finish her talk, because we like to say once again on behalf of the network, thank you, Sister Charlene, for your time. I know you got some green. Hopefully, you got some green tea over there while you're sipping and talking. But okay, but family, come on now. Okay, anybody who hasn't spoken, this is your time to ask a question or make a comment. Come right on in. Take yourself off mute. Okay.
I just wanted to help
Sister Latoya, hold up for a minute, sis. Hold up. Go right ahead, Sister Latoya. I'm going to bring you guys. You know how I like to bring you in. Come on.
All right, I can answer it. I can go right ahead, Miss Nance?
No, I thought you wanted to say something. Go ahead, sis.
Okay. So what Leon had wanted, his question was, he wanted to answer, what is the difference in person?
Wait a minute. Sister Latoya, let me stop you. Leon has no problem with, he said he rested. Now you're asking a question for Leon. We want to know what you want to say, sis.
No. He wanted to answer a question, but
But Leon can speak for himself, Sister Latoya.
I understand, but the only thing I just wanted to help him out with the question.
No, he don't need no help out. We need to know what you need to ask, sister. Because Leon could come back in if you like. Leon is probably listening. So what would you like to ask, Sister Charlene?
I just only wanted to help him out. The question.
No, you don't. Okay, sis. I'm gonna let you rest on that part because we need to go forward now. Sister Charlene, can you finish your presentation? Because Leon can speak for himself.
Can I ask Sister Charlene another question?
Come right on in, Brother Leon.
I heard her. Sister Charlene, I got a comment for you, but I want to ask you two questions. They're real quick questions. I heard you say you've had 8 concussions. I did hear that right, correct?
Yes, sir.
Have you ever had any kind of seizures with any of those kind of concussions?
No, I have not.
Okay. My comment to you was going to be for a person that has 8 concussions that may have had a seizure with it, that, you are very... It doesn't seem like to me the trauma, because that's what concussions are, the traumas to the brain. You're very informative. You remember everything, because people with concussions, it takes their memory. Every time, like you was talking about rerouting things, the reason why the person was rerouted is because they forget. And every time you have a seizure, it takes your memory away, or it takes some of your memory away. And that's why things have to be rerouted. But my comment to you is that you're very informational for a person who's had 8 concussions. I see that you haven't lost a step or a beat, and I treasure that. Thank you.
Thank you, sir. But I did stack the deck.
I know you did, but it's okay. It's okay though. It's okay. Listen, it's okay that you stacked the deck, because none of us seen you cheating, so you're good.
Thank you, Brother Leon. I appreciate it, brother.
What I will say is I did have a photographic memory and an didactic memory. And my memory is just beginning to come back after 5 years of hard work to the level that I had before my 8th concussion. So I did suffer some impairment, and in many places I did suffer some loss, because the last one I got hit, and I could see it coming, but there was nothing I could do, and there was nowhere I could go. And then after the car hit me, I was like, oh no, I got hurt for real, for real. I'm from inner city Philadelphia, so we have a term called for real, for real. And that means that you really, really, really got hurt. So, but I got to the point where I had to create new protocols for myself, because the way that I needed to retrieve and the information that I was desperate to retrieve, they didn't have I didn't get as much information from the medical community about my retrieval that I wanted, so I created some things on my own. But thank you so much for mentioning that. If you lose your memories, part of the trauma of your accidents comes to the forefront. So I appreciate you mentioning that. Was there someone else that wanted to say something else before we move?
Yeah, before we move on, real quick, and please ask the question.
Nope, that was my question. That was it.
Okay, thank you, LaToya. Okay. Now, please put yourself on mute if you don't have anything else to say. That goes for everyone, all right? If there's someone who hasn't spoken, please speak up now. Ask the question to our dear Sister Charlene. No questions? So everybody's doing good with their brain. That sounds good. Okay, Sister Charlene, I'm going to let you finish. I'm going to ask the question, and then we're going to call the night. Sister, go right ahead, Sister Charlene. Thank you once again for your time.
All right. So I'm on the slide that says neuroplasticity, and basically your brain does have capacity to rewire. So the good news about the brain, whether it's the infant brain, the youth brain, the teenager brain, the college kid brain, the adult brain. Now remember, your brain doesn't seal shut until you're 25 years of age. So it's still a little bit open, and it doesn't completely seal shut. The top of the brain does not seal shut until you're 25. But after you're 25 years old, then, even then, your brain is not a fixed machine. It still continues to acquire more information, and it is a dynamic, living, structural organ, okay? So the question is, neuroplasticity is on the table for every injured brain in this room. And the question is, how do we circle back? How do we access our brain's capacity to rewire? So there are targeted pieces, meaning I have a lot of my seniors learn an instrument or begin to play piano. For my guys who are CEOs or who have are very good with numbers, I have them learn the Indian way of being able to compute mathematics. Essentially, you have to learn something new to rewire your brain. Your brain has to learn something in order to make new neural pathways. And then you can kind of use it as a boost to be able to remember things that you have done in the past. Okay? Stress reduction is always on the table because cortisol is neurotoxic, meaning cortisol has a tendency to swell things. It swells your body, it swells your brain, it swells your skin, it swells your organs, right? Your brain is an organ, your skin is an organ, and if you have tons and tons and tons and tons of stress, it's the same thing as having a phone that always messes up. And so, when you have those challenges, the first thing they tell you to do when you call Verizon is to shut your phone off, right? And so when it comes to stress reduction, one of those things are, you're going to have to slow down. Your body forces you to do it. But mentally, making sure that you understand how to handle psychologically slowing down is 100% something that's massively important. I want to talk super fast about restorative sleep and aerobic exercise, but when it comes to sleep, we have two systems that manage your waste and trash removal in the body. The first one is the lymphatic system, which are heavily located underneath your arms, in the middle of your clavicle, underneath your breasts if you're women, in the groin area for both males and females, and certainly on the bottoms of your feet. And those are your trash waste systems. So when they are dumping things into your system to try to get rid of things, sometimes you can get a little smelly, right? But the glymphatic system is the system that removes metabolic waste in your brain. And the downside of the glymphatic system is that it doesn't work all the time. It only works when you are in REM, when you are in rapid eye movement sleep, when you are in deep sleep. So you actually have to go to sleep. And I don't just mean light sleep. I mean, you have to be able to sink all the way down into the healing aspect of the sleep. That's why, you're supposed to get at least 6 to 8 or even 10 hours of sleep on a daily basis. And if you are not sleeping, you are not healing. Your brain is not going to have the ability to heal, which means the glymphatic system, which is the most critical window for your neurological repair, it's not even going to be able to work. So in other words, for every time that you go to sleep 2 hours, 3 hours, sometimes 4 hours a night, or you're napping here and there and everywhere, your glymphatic system is not shutting on. So a lot of times the challenges that I have with my seniors is not that they aren't active, but they're not healing. So healing has to be your number one priority as far as sleep is concerned. Not, not other. Sure.
Or maybe a statement that you said that. Now I'm always looking up stuff. Now this was years ago, and I don't remember what the fluid is. But being that you said that you're not healing when you're sleeping, what I've learned was that when you go to sleep in deep sleep, there's this fluid that shoots up the spine and cleanses out the brain or something like that. It comes out of the spine and it washes out the brain and drains out. And if you don't get proper sleep, like deep sleep, the brain doesn't get that washing the way it's supposed to. I'm not sure if I'm saying it correctly, but I saw this years ago. So I think that that's what you're talking about.
Your glymphatic system, yes, ma'am. But I'm talking about you cleaning. It's not like a water hose. it's really the cellular switch to get rid of all of your waste products. So there's waste products in the cells, and there's waste product out of the cells. And what it does, the glymphatic system, is at a specific time in your sleep cycle, that switch goes on, and all of the brain discharges the waste products, and then your body is able to shunt them into your lymphatic system, and you're able to get rid of your waste products. So just like your...
I'm so sorry. One more thing before you go there, because the other thing I heard in that documentary was that also prevents amnesia or Alzheimer's issues with the brain. When we get proper sleep and your brain, that system flushes out properly, it prevents any type of ailment with the brain.
So Alzheimer's and dementia, I will say a yes and a no to that, actually. And the reason is because our artificial foods and food colors and artificial food dyes, all artificial sugars cause holes in the brain, literal holes. All of my sweet and lowers, those little pink packets of sweet and lows, in 2026, it's all my equals, all the people that are using the equals, and there's so many different types of fake sugars that we are taking in order to confuse the brain. All of my Diet Cokers, all of my peeps that are comfortable drinking fake sugar prepare to have a brain impairment moving forward in the future, because those pieces are designed by chemical engineers and bioengineers to have a direct negative response to the human brain. They're designed to taste good on the front end and to leave holes on the back end. So just understand that if it's not natural, there are some serious consequences to ingesting artificial flavors, food, dyes, and sweeteners.
Okay.
Thank you, Arlene, real quick. All right, so real quick, sis, do you remember a while back, and I think when Leon was on my network, the brother that was speaking earlier, we talked about this, we had mentioned this. There was a gentleman, a young man, and he was born blind. His parents could see. And it was on 60 Minutes, and what happened was they showed on the screen how when he played music, the part of his brain lit up that was supposed to bring visual into his optic nerve or his eyeballs. Did you see that?
No, sir, I didn't. But
you
my
missed
best
that.
friend is blind.
Right, and it showed where that part of his brain that gives vision had lit up, and then when he stopped playing, it went right back to the condition it was before he started playing music. And he was a musical genius because he taught himself. Somebody like, look at the geniuses that can't see. You got Stevie Wonder, you got Ray Charles, and they were geniuses when it came to music. Some of our top giants in the culture, So you're right about that. And I was getting ready to ask you, the glymphatic system, along with the lymphatic, I learned a long time ago that you buy yourself a rebounder. And I've mentioned this several times, Sister Charlene, to the listening audience. Buy yourself a rebounder and jump up and down it for 10 minutes. Sometimes I get on there and I feel good. I'll jump for like 15, 20, 25 minutes. Depends on how I feel. Take my shirt off and sweat, And I know that when you advise our listening audience to get a rebounder for the lymphatic system to help keep it clean, or what they call a vibrating plate.
So I'll clarify. So a rebounder, for anybody that doesn't know what it is a mini trampoline, and is basically what it does is it helps to reset your your waist movement system. So if you didn't use the trampoline, you could run. People who don't use the trampoline, they can walk, but it still won't do as much as the jumping up and down will. And so what it does is, for the lymphatic system, it helps to drain. So a lot of times the lymphatic system will collect the waste, but then it won't. The body doesn't know how to throw it away. So shaking the body up and down, what it does is it kind of sort of moves the clogged places and allows things to drain in the proper way. So, if you're thinking of a sewage, the sewage pipes that are on the regular streets, well, there are things that can clog up those sewage pipes, like leaves. If you get some leaves in there, and then you have a whole flood, right, where the liquid is not draining. And so if you have a rebounder, I absolutely recommend, it would be one of my number one things to recommend if you do not have a traumatic brain injury. Because if your inner ear crystals are not hanging properly, then what's going to happen is when you jump up and down, it will tell your brain, I don't know where I am in time and space. So there are people who cannot do it, and those are people who have a new injury. However, if, jumping up on the side of the bed, you don't have to use your feet. You can sit on the side of bed like a little kid when we were, bouncing up and down. It doesn't even have to be a ginormous aspect of physiological movement, but just the motion of jumping or sitting and going up and down, or many times we put people on balls, those big giant balls, and they jump up or sit up and down and bounce on the balls. That will still trigger the same areas, but it won't do the same exact thing. But 1,000% I would recommend rebounding. You don't even have to jump where the feet leave the actual trampoline. You just have to do the bounce. And it retrains your body to throw the additional liquid and the toxin that is in the liquid away. Why? Because you have two choices. Either you're going to reabsorb. If your body doesn't get rid of it, it will reabsorb it. It'll create additional fat tissue to throw it away into something if you can't get everything in the right chutes to urinate it out.
Okay. Now, with that being said, Sister Charlotte, I'm going to let you finish your talk. I'm going to ask you a question, and we're going to call it a night. And I want to thank you once again for coming in. So, Sister, I think you had one or two more points you wanted to make, and I'm going to let you close out.
The last one I was going to...
She had somebody that was blind. She said she had somebody that was blind in her family.
No, my best friend was blind.
Oh, okay.
I'm sorry.
Go ahead, Leon. You want to ask a question, brother?
No. I heard her say something about somebody that was blind, and I just wanted to know who she's familiar with. So if I told you that I was totally blind, what would you say, and how often should you jump on that
rebounder?
On the rebounder, how often should you jump? Every day?
Oh, for sure. So if I told you were blind, what would I say? I would say hi.
Yeah. Oh, wow.
Keep yourself on mute unless you're making a comment or a question. Go right ahead.
Then you can go ahead and say hi, because I'm totally blind.
Okay.
Oh, wonderful. Well, thank you so much. I hope that I was articulate enough.
Yes, you were.
Oh, thank you so much.
My blindness has nothing to do with, and this is for anybody that's on the line.
For your ears. I know that.
No, not my ears. My intelligence. My blindness has nothing to do with my intelligence at all.
Mm-hmm. Brother Leon never lied about that. He's right about that. Thank you, Leon. Hey, somebody else wants to ask a question. Come right in.
This is Sister Lori.
So hold on. Okay. I want to answer Brother Leon's second.
Oh, you want to finish? My apologies. Go right ahead, sis.
No worries. So usually,
hold on, Lori.
Okay. Usually, hold on. I want to answer his second question. So if you are going, you have choices. You can actually literally jump up and down, but usually I have my peeps that have a balance issue or who are partially or totally blind, hold on to the back of a chair in the corner, and then you can jump up and down. There are trampolines that have handles, and you are welcome to step on the handle, and then, you can bounce up and down. But remember, getting on the trampoline and off the trampoline may be a little bit tough. They have teeny tiny trampolines and they have big giant ones. So depending on how it is that you want to do that. But if you back yourself into the corner or hold on to the kitchen sink. Kitchen sink is like my number one favorite way to teach lymphatic drainage for my peeps that either have a balance challenge or who are vision impaired. Okay, you just hold on to the kitchen sink, and you can bounce your way. Your feet don't even have to leave the ground, but you will still get the same impact as somebody who is on a rebounder. Is that helpful, Leon?
Yes, I'm going to try that. I stay at the kitchen sink enough washing dishes, so now I'm going to stay there and bounce.
Absolutely. Okay. I want to make sure you were served, okay?
Right.
Yes, thank you.
Thank you, Leon. Appreciate it. Come on, Lori, real quick. Come on.
Just want to say one thing. You're beautiful. I love your podcast. I love your platform, and it's wonderful. Just for the ladies, I just want to say that Zumba has been one of the things that people never talk about, but that does have great benefits. Would you recommend Zumba classes? I know there's one for Santal or seated Zumba, but would you recommend that?
I recommend all exercise. Whatever you're willing to physically do, do it. But the challenge with Zumba is more, it is aerobic exercise, but it's also, you can't have a brain impairment or a brain injury. You have to have strong ankles, and they don't give enough education about how to manage your cardiac response. So if your blood pressure is going up too high, then that means you can't bring your hands over top of your head so that you can stay in your cardiac range, okay?
Yes.
But when it comes to the restorative effect of movement, I'm encouraging everybody to move. Move to whatever you're willing to do. Sometimes people need people, so then Zumba would be a good thing because there are other people there. Sometimes people are more comfortable going at a slower pace. I'm totally comfortable with that. But your heart does need the practice of being able to speed up and slow down. And that's what aerobic exercise is. Okay?
Yes, ma'am. Love it.
Thank you, Lori. Thank you. Appreciate that. Sister Arlene, let me know when we get to 8:30. I'd like to remind the audience that Elle from Long Island will normally come on at 8 o'clock, but the sister's under the weather, so she'll be back on the first week of the month of July. And also, this is not the last show of the evening, family. We have Brother Watley Bey coming in with the Sultan of Morocco at 9 p.m. All right, so we're going to make sure we give the brother a little time, get in a little time for you guys to get a little snack or something healthy to eat. You hear what Sister Charlene said? Keep that processed crap out your mouth. You want something sweet, get an apple, get a peach, get something healthy with natural sugar in it. Okay? Go right ahead, sister. I'm going to let you finish, and we're going to call it the evening.
Sure. To be in Sister Arlene, correct? No, I'm saying her name wrong again. I apologize. But I don't have no light perception in my right eye since the age of 14. I do have peripheral and central vision in my left eye. And I did have a stroke. But I think the rebound that probably can work for me. Cause that
and
was
what's
one.
Your name again?
Latoya.
Okay.
I'm the one I would say I'm the one that was born with the birth defect. Yes, ma'am. Yes, ma'am.
So I would do one of two things. I would start off bouncing on the side of the bed. You don't even have to, it doesn't even have to be, a whole lot. And see how your body handles something small. And then I would go to the sink and I would hold on. And I would go, see if you can give 25 bounces all at once. And if you can, see if you can get to 50 all at once. It's a big deal. But I would try something small before I would invest in a rebounder, because everybody can't handle the up and down. See, it's not what you can do that makes a difference. It's how you recover. So if you can do it but you can't recover well, then you can't do it. Does that make sense?
Yes,
the
ma'am.
Equation isn't what you can do, it's how are you going to be able to recover. So if you can do it and you can't recover, then you can't do it. Even if it's easy, even if it appears simple, your body says no. It doesn't mean your muscles say no. Sometimes your head says no. Sometimes your cardiac response says no. Sometimes your equilibrium says no. But it's not what you can do when you're trying new things. It's how you can recover. And if you're not recovering right now, it's going to be a no until you get, better recovered. So am I suggesting that you would purchase a rebounder right away? I would suggest you try bouncing up and down on the bed. If you're successful at that, I would suggest that you hold on to the sink and try bouncing up and down, while holding down on the sink. But if you cannot handle the bouncing up and down, I wouldn't recommend that you go to a more unstable surface. Does that make sense?
Yes, ma'am. But honestly, with you, I did all that already. On the podcast, the health man had me ripping and running up and down the stairs, bouncing up and down. I did all of it. I did all of it. I would.
Okay. Well, whatever you can do safely. Whatever you can do safely. Again,
yes,
I don't know what he had you doing.
Yes.
And as your injuries are being described to me, I would certainly take a more conservative approach. But if you're saying that that's something that you want to do, again, it's not what you can do, because physiologically you may be able to do a lot of great stuff. Okay. But my question is, how are you resolving? How are you, if you're not resolving, maybe you resolve in 2 days, maybe you don't resolve at all. Like, again, it's not what you can do, it's how are you recovering.
Okay, ma'am. All right. Thank you so much for answering my question.
Well, thank you. Thank you, Sister LaToya.
How do you know when you recover? How do you know when you recover? I just went to my sink and I did what you suggested to do, probably about 50 times, and it actually made me dizzy, but not for long. By the time I got back into my living room, I was fine. The dizziness was gone. But when you say recover, what's that mean?
Okay, so that means that if you did 50, then maybe the first time you do it, you're going to do 25. You don't take yourself up to the dizziness place. Does that make sense?
It makes sense.
Yeah, so everybody needs to understand what their threshold is, or what their hard stop limit is, right? So for you, your hard stop limit on day 1 is 50. 50 is too much. Could you do it with your body? You could. But the question is, what are the side effects of actually doing it, right? So your side effects was that you're dizzy, okay? Now, good news, you could march it out until you're less dizzy, but my recommendation, since I work with people who have complex medical conditions, my recommendation is, if you know that 50 is the number that makes you dizzy, don't do 50, do 25. And 25 may make you a little tiny bit woozy, but if you march it out after, 5 or 6 or 10 breaths, then you might kind of sort of level out and be okay, right? So what recovery looks like is, if you are completely off balance and unable to recapture your balance while being dizzy, then that's not going to be optimal. It doesn't mean don't do it. It just means do less.
Yes.
Is that helpful?
Yes, it is. And I'll try that tomorrow morning.
Awesome.
Thank you, Brother Leon. Okay, Sister Charlene, what we're going to do is let you finish, give out your contact information, and we are going to call the night after I ask my question, and then we will call the night. But go right ahead, Sister Charlene.
Okay.
It is now 8:15.
Thank you, sis.
Okay. All right. So I've scrolled through the rest of my slides so that everybody would have an opportunity to read them after they get the download, or in Brother Leon's case, would be able to hear them. So initially, or essentially, the cognitive rehabilitation or rebuilding the software was what I spoke about earlier, about how do you get your brain back after you got hurt, right? And the long and short of it is there are glasses that they will give you. They are able, the rehab department is able to look at your eyeballs, and so even if you are vision impaired, they will still be able to look at your eyeballs to see which way your eyes are tracking, so then they can tip your head and hold your head at a specific position to realign your inner ear crystals. And those are one of the most, I want to say, severe signs and symptoms of needing some assistance of a healthcare professional. If you're standing up and you're completely dizzy all the time, then your inner ear crystals, it's highly likely that they need to be readjusted. Okay, if you have no balance, or if you're stumbling all of the time, your inner ear crystals highly likely, especially if you had head trauma or if you've been in a couple car accidents and your balance is just getting worse and worse and worse. We don't really have, the one major factor that they say is vertigo. But I never had vertigo as in the description that they said. They always asked me, was the room spinning? And I was like, no. But my eyeballs weren't at rest. Meaning when you close your eyes and it's time for you to go to sleep, if your eyeballs are going left, right, left, right, left, right, left, right, that's a sign and symptom of vertigo. Now, if they would have asked me that, I would have said yes a whole lot earlier. But at the end of the day, your brain is a tattletale and the human body is a tattletale, and it will tell you what it needs. Okay? I hope this information was helpful.
It is. It is.
Oh,
yes.
I'm so glad.
Thank you so much.
Oh, I'm so glad. I wanted you guys to be able to have as much information as I could give. So,
and thank you. You can after this show, you can go to the YouTube channel and watch the video so that you can read the slides. Okay.
Absolutely. So for my information, you are welcome to text me. Contact me at Charlene T as in tree, Charlene T Harper at gmail.com. My link tree was disabled to add some other pieces, but it should be back up on Monday. Charlene T Harper. But if you have any other questions, I am happy to.
Charlene, don't do that. They're going to start flooding more. They're going up the floodgates here. Hold on for a minute. Okay. So look, before we send anybody out, because I got the final question for Charlene. If y'all have nothing else to say, I'm going to end this. So come on, y'all. Any questions? Last minute. Come on.
Forrest, quick question. Where is she located?
I'm in Boston, Massachusetts, but I have a practice that is on Zoom, and I do rehab compliance. You can find me on LinkedIn. But the long and short of it is I review cases for people. I review medical cases to make recommendations for legal and to make recommendations for where it is that you are. Usually I'm able to catch things in a very different way because I've been doing this for 35 years. But, if you have any additional questions, I'm certainly happy to help you in any way that I can.
Yeah.
Melvin, you got that information?
Yeah.
Can you repeat your email again, please?
Sure. It is Charlene.Harper. I'm sorry. I'm looking at a whole different one. Mine is Charlene T. Harper. T is in tree. Charlene T. Harper at Charlene T. Harper at gmail.com.
Thank you, ma'am. Thank you.
And Charlene,
Yes.
Charlene is with a C, right?
Yes.
Okay,
yes.
not an S, because I know a young lady spells her name Charlene with an S.
Yes.
Everybody wants to be a
Charlene
little
with a Charlene T. Harper, Harper.
Right. Now, this is what I want to end, because everybody knows that most of the time when I have guests, they talk health and healing and nutrition. What are some of the foods that would be on your bucket list in terms of what one should consistently or as often as possible consume? And what you mentioned the processed foods, because we mentioned that several times. Brother Rashad and all the other people I bring up here, we always talk about the foods to avoid. But what foods would you take in that would help keep your brain as healthy as possible, maybe offset dementia and Alzheimer's?
So my number one recommendation would be live foods. So foods come in different categories. And what I mean by that is we have fresh foods, we have frozen foods, we have canned foods, and we have processed foods. And so if you have to pick anything, fresh is best. Fresh would be number one. The next best one is frozen. And then the next best one is, canned. I'm not a huge fan of canned food. Is it better than not eating anything at all? Yes. Do I recommend it for optimal brain health? No. Unless it's like sardines. But for the most part, fresh fruits and vegetables, things that are unprocessed and or uncooked would be the best for your brain repair. So a lot of times, if you can look on there are a million YouTube videos that will give you information about juicing. I recommend juicing, but I think blending is, if you have to do anything, if you have to blend stuff, or if you have to get some stuff in, my preference is blending, because what blending does, you still get the fiber. So there are a number of different pieces that you can eat. There are fresh fruits and vegetables. There are nuts and seeds. There are, those are pretty much the main things. I don't have a tendency to recommend much grain, not because of anything other than grains often cause inflammation and swelling. And if you have a parasite protocol, which we didn't discuss today, they eat starch. So my recommendation is for you to, if you can, to do fresh. If you can eat it whole, where your teeth do the work to chop it up, and it combines with the saliva, and then it goes down, and you are eating things on your own, that's my recommendation. But if what I do not recommend are the protein drinks. Now that's surprising, I know, but my preference is that you do not do pre-digested foods, that you eat them yourself. that you do the work to digest your food. Is it better than absolutely nothing? Yes, but it also, the side effects of it are often drastic. So still, my preference is for you to eat the food or you to drink fresh fruits and vegetables over everything else. And I do eat meat. However, I don't do a lot of red meat, and I do not eat pork. So if you cannot eat pork, that would probably be the most optimal thing for your brain health. Okay?
Well, thank you, sister. And before we go, we got 5 minutes, last-minute questions from somebody who has not spoken. Come right on in. Joffrey, you sound like I heard your voice. You wanted to say something, brother? Thought I heard Joffrey.
I have a trivial question for your guest, Forrest.
Go right ahead, brother.
The young lady who spoke about Zumba, if she's on the line,
Lord.
right? I would like to ask you a question. I want to know who you know that was the first person that gave us Zumba.
Well, to me, Zumba came from Africa, but the guy that brought it to the United States, what's his name? Bento. I can't pronounce his name, but he brought it as an aerobic exercise.
I'm gonna say you're right about Ikebana. That's first of all, which Americans know it as Africa, but it's called Ikebana. I want to say Jackie Lane is the one who I watched. Yes, Jackie Lane is the one who I know. I don't go back farther than him, but he's the first person who I've seen that was on TV at the time. And TV had just came out back then, and when he was doing the exercise thing, looked like Zumba.
Yeah, I mean, Zumba has been traditionally, Zumba has been traditionally marketed as an exercise that you're losing weight and all this. But what I've noticed is it really increases your endorphins. Well, people that normally don't sweat a lot, they are sweating like bullets in Zumba, and they're a lot happier. And I said to myself, well, I need to ask that question because I like to go back to it. But it does make a difference. That and Pilates, the spinal health, it does make a difference. And I wasn't even supposed to be on the broadcast today. I just thought I'd chime in. But it's really remarkable. I mean, we as Africans, we've had this in our history for years. It's just that Americans taking it and remarket it into something that, is really not what it's designed to do. But it's, I just love my African culture, so that's all I'm saying.
And this is Charlene. Jack LaLanne, while he may have done exercise, he really was one of the pioneers of the juicing world.
Yes.
So I do want to put that on the table. And his company still has his brand of juicer. So both him and his wife were pioneers in the juicing world. However, those eating fresh fruits and vegetables in Africa, they perfected it long before it came to the U.S. of A.
Of course they did, Okay, well, with that being said,
I would say thank you for mentioning me, but no, I'm just listening, and I'm enjoying the program. I hope we continue for another 3 hours. If the guest has the time, forget the host wanting to go lay down.
No.
Questions.
Brother Watley Bay is coming in at 9 o'clock, but we can't go another 3 hours.
That's right. Brother Bay is coming on. Okay.
Hey, Joffrey, save the extra 3 hours for Ed's night. That's Ed's night. Okay, hey, family, listen. I'd like to thank you guys. And just to give you a heads up, I got to give you the itinerary for tomorrow. Now, tomorrow's Sunday. we start off 7 a.m. with the prayer call with Miss Carolyn Lucille. She's up here every day at 7 a.m., the hardest working lady on the network. After that, we have another prayer call, just only on Sunday, 8:30, Watering Your Spirit with Dr. Yvonne. After that, at 12 noon, we have the new Black Panther Party with Chairman Africa and General Patience, his wife. After that, 3 o'clock, we have Chandra at 3 p.m., Sister Chandra, okay? Then at 4:45, Brother Watley Bay, who's coming on at 9 o'clock with the Sultan, but he also comes on with Knowledge is the New Power tomorrow at 4:45. Then we got Coach C at 7:30, all right? And she talks health and nutrition. And then we will end the night with our dear brother Abdul Ishmael, the health man, who will be one of the keynote speakers at our August 8th event, all right? And also, y'all, next year I'm working on King Simon because I had him on. Y'all remember King Simon came in, the numerologist, all right? He's going to be a guest. And we're going to try to get Sister Charlene to, gas up the pace or whatever the case may be, and come on down next year if that's possible. We'd love to have her down next year. She might surprise us this year for y'all, for those of you who are coming this year. So let's keep our fingers crossed because I would definitely like to make her speaker and very prominent, as you can see, for next year. So with that being said, get you something to drink. Get you something to munch on healthy. You heard what she said. Leave that mac and cheese on. You got something in the refrigerator. I ain't going to tell you to throw it out, but say that for Brother Joffrey. You can mail it to him, and if it turns yellow to green, he'll still eat it. But that's my dear brother. I love Joffrey. He knows that. So with that being said, Sister Charlene, on behalf of the network, thank you, sister. And hopefully this won't, not by the grace of Most High, this won't be the last time you come on, sister. I really appreciate you for coming on because you spent a little over 2 hours with us. Sister Arlene, you can end the recording if you like, sister.
Oh, okay.